Hello everyone. This video will be useful for you to learn and understand about respectful maternity care. Respectful maternity care, it's basically a rational approach for improving person-centered or patient-centered or mother-centered intrapartum and postpartum care. So that only we are going to see about in this video. Objectives. We're going to learn about the definition of RMC, general concepts, key stakeholders, types of abuse and respects, and describe the rights of respectful maternity care. Present key recommendation for respectful maternity care. First is definition. So, as I said earlier, respectful maternity care is a well described rational approach for improving person centered and equitable intrapartum and postpartum care. Okay, so but it is lacking in standard definition, clear measurements and methods and evidence for the effectiveness. But as we see here, the definition is respectful maternity care is an approach centered on an individual basis on principles of ethics and respect for human rights and promotes practices that recognizes human preferences and women and newborn needs. Respectful maternity care is a universal human right that is due to every childbearing woman in every healthcare system. Now, we'll see the general concepts of the respectful maternity care. It focuses on the interpersonal aspect of maternity care and it emphasizes the fundamental rights of the mother, newborn, and families, including protecting the mother baby pair. It recognizes that all childbearing women need and deserve respectful care and protection of the woman's right to choices and preferences. And these are some of the general concepts of respectful maternity care. Now, let's see about the key stakeholders in RMC. So, who are all coming to act in this concept is the pregnant women, families, communities, in healthcare providers, individual healthcare providers, professional associations, training institutions, policy maker donors, human rights activists, and women advocates. These are the persons that come into play when it comes to respectful maternity care. So these are the person we have to teach them and train them regarding this concept. Now we'll see the types of abuse and disrespects. So these are some of the types of abuse that are present in the respectful maternity care. Okay, so the common themes includes freedom from abuse, consent, privacy, dignity, communication, safety, and justice. Okay, so these are the literature based and we'll see it one by one. First is physical abuse. So this is an example of physical abuse. When a woman goes into the second stage of delivery, you don't want her to close the legs. So you're beating her. It happened in Uganga Slattery Mahatasoon 2007. Okay, it happened in Kenya. So as it said here, when the second stage of labor is happening, okay, we cannot use any physical abuse or verbal abuse even to the mother. Okay, so that's very that's one of the thing we have to learn and we have to keep in mind when conducting the delivery. Next is non-consented care. Providing explanation to the less educated woman is not a good use of time as they just can't understand. So this was said it was given by Fon et al. In 2001. Okay, so whatever the patient literacy level, whether they are educated or uneducated, it is our duty to explain them, and we cannot just think that no need to waste your time in explaining this woman because she can't understand anything. It's not so. She can understand. She knows everything about her health and her baby's health. So it is our duty to explain the patient as well as the family whatever doubts they ask. Okay. Next is non-confidential care. This is another example. I was assisted by one of the patients who was waiting to give birth. The nurse later came and took the baby, then told me to get up and wipe the bed. This happened in Kenya. Okay, so this is one of the things where they ask the patient herself to do the care. Where we are supposed to do all this, we are asking the patient to do by her own. So this is one kind of non-confidential care. We cannot do it. Okay. Non-dignified care. One nurse told me, "Lady, can't you see that you are in the way? Go over there. You aren't anything but an animal. I'm talking to you is like talking to an animal." This was happened in Republic. So we here they are treating the patient or the mother like an animal. Like you have, they have even said the word animal. Okay, so that shouldn't happen. Okay, so dignified. Okay, we have to consider them dignified, and we have to respect them for who they are. Okay, and call the patient by their okay address, Mr. or Mrs. So and so. Discrimination. Everything that came out of her mouth was the color of my skin. She goes, "You're the first dark person I've ever had." I sat there and I had to deal with that. After that, I left and never went back. This happened in USA. So here what they say is they wanted to mention the baby's color here. Okay, so they are talking about the race here, something what a professional person should not have this kind of attitude. Okay, so this is not to be mentioned by anyone. Okay, so this is one example for discrimination. Abandonment of care. You just call until you get tired and then you finally deliver by yourself and die. I have even witnessed it myself. It happened in Kenya. So this is some kind of care where we are abandoning. We are not giving on the time. Okay, you may give, but even if it is not given on time, that also comes as an abandonment of care. Okay, so our attending a mother in her second stage of labor, in the third stage of labor is very important, right? So what here they are saying is they are allowing the mother to deliver by herself, and they are allowing her to die. So that shouldn't happen. Okay, that we are of course it's not happening here, but still you should know there is no it shouldn't happen. Like even the timely help is very needed. Timely care, timely interventions are very essential in saving the life of the woman and the baby. Next is detention is facilities. When I got the bill, the doctor said to me, "Since you have not paid, we will keep you here." Okay, so you may have heard about this in one or the other hospitals happening like this. Like if the patient is not paying, they will keep the patient there. Okay, they will not discharge them even if they are fit to go home, they will not discharge them. So that shouldn't happen. So these were some of the types of abuse and disrespects. We saw about the abuse, physical abuse, non-consented care, non-dignified care, and we saw about the abandonment of care and detention in facilities. Okay, next we'll see about the rights in the maternity care. What are the rights? Human rights in maternity care. They are like freedom from harm and ill treatment. The mother has the right for information. Mother has the right for informed consent, refusal, and respect for choices and preferences, including the right for companionship of choice wherever possible, and confidentiality and privacy. Next, rights are dignity and respect. The mother has rights for equality, freedom from discrimination, and equitable care, right to timely health care and to the highest attainable level of health, self determination, and freedom from coercion. So, what are the care that are promoted by respectful maternity care concepts? Or respect for beliefs. We believe we respect their beliefs, their traditions, and their culture, and empowerment of the woman and her family to become active participant in the healthcare. Okay, it means allowing the mother to take some decisions regarding her. Okay, some decisions regarding the interventions, some whether she want it or not. Okay, so that is called empowerment of women. And continuous support during labor and choice of companion during labor and birth wherever possible. So the mother can choose who she want to be accompanied with. Okay, and that is such a rights we are giving to the mother, and right to information and privacy and freedom of movement during labor, and good communication between client and provider. So this RMC will promote good communication between client and provider, and support of the mother and baby pair, improvement of working conditions, respectful and collaborative relationship among all cadres of health workers, prevent of disrespect and abuse against the woman. So now we'll see what are the life-saving measures that are coming under the RMC. RMC is a life-saving because a woman may refuse to seek care from a provider who abuses them or does not treat them well, even if the provider is skilled in preventing and managing the complications. That happens, right? Yeah, if some of the doctors or nurses you find they have, they use physical abuse or verbal abuse, you never go back to them. Okay, even if they are very skilled in preventing and managing any kind of complications, where no patients will go to them. Okay, we always want a person who will talk to us, okay, nicely. Next is, reviewed studies suggest that fear of disrespect and abuse may sometimes be a more powerful obstacle to the use of skilled birth care than geographical and financial reasons. Okay, so this geographical and financial reasons also can be overcome. It means if the mother is in the remote area, that reasons can be overcome and she can be given the access to the skilled birth. But if the woman is having fear of disrespect and abuse, she will never come to the skilled birth attendant. Okay, so that is the fear they have. Okay, the studies also suggest this kind of reason. So next we'll see about the recommendations of RMC. What all it recommends? It includes advocacy at all in levels to increase awareness, involve community and media in each step of the process, conduct studies on women's preferences and choices related to respectful maternity care, ensure political commitment at all levels. So what they are saying here is, whoever is involved in the mother care, whoever is involved in the maternity care should be educated about this concept. Okay, that there is a concept called respectful maternity care, and there are some rights that is to be given for the mother. Knowledge, skills, and attitude that support RMC must be included in all educations and training programs that involve healthcare workers, and mobilize resources to support implementation of RMC. So I hope you gained some knowledge regarding respectful maternity care. We see the introduction, the definition, the key stakeholders of the respectful maternity care, and the types of abuse and disrespects, and also we saw some of the life-saving measures and the rights of respectful maternity care, and we saw the general recommendations in it. I hope you gained some knowledge regarding this topic. Thank you all.